Good morning, everybody, and welcome to the September 20th, 2020 press conference here on behalf of the Board of County Commissioners and Palm Beach County Government. We're here at the Emergency Operations Center. We're at day 249 of the emergency activation at level 2. The local state of emergency remains in effect for the 37th time, as does the governor's order pertaining to COVID-19. I'm joined with the team here today. To my left, Commissioner Greg Weiss. Also, Commissioner Mac Bernard. To my right, we have, on behalf of Sheriff Rick Bradshaw, Captain Kirshner from Palm Beach County Sheriff's Office. We're also joined by Virdina Baker, our Incident Commander and County Administrator, along with Dr. Alonzo, the Director of Department of Health, and also Julie Ditalo, who is the interim CEO of a very important institution in this county, particularly during these challenging times in COVID-19. And that is a Career Source, which is an agency on behalf of the state and county that assists in reemployment and employment issues. And she'll have some important information regarding how residents of this county can access more resources related to finding jobs and reemployment in this difficult economy. I'm going to start right off by turning it over to Dr. Alina Alonzo for an update on the health metrics in Palm Beach County and throughout the state, and then we'll return to me. Then we'll go to Commissioner Weiss, Julie Ditalo, and Ms. Virdina Baker, and then we'll have some time for some questions. Doctor?
Good afternoon, and thank you very much, Mayor. I'm going to concentrate just on the Palm Beach numbers, just for the interest of time, and I know that that's what most people really want to hear about. So for Palm Beach County, we have a total of 60,729 cases. That's 499 new cases as of yesterday. We are seeing those numbers fluctuate. We know that our averages were way down to 100, and now each week they're going up a little bit, and that's to be expected. We have hired sufficient staff to make sure that we continue doing our contact tracing and making sure that we can capture as many people as possible to quarantine so that the virus does not spread. The positivity rate remains above 5 since 11/6, and that's what makes this contact tracing now become a little harder to do. We had 2 days on 11/13 and on 11/16 where the daily positivity was 10.44 and 9.95. Once your positivity rate goes above 10, you have widespread county virus, okay? And what happens then is that the ability to understand who spread it to you goes way down, because there's so many people that are asymptomatic that you don't know where you caught it from. So that makes then the contact tracing less effective. It doesn't matter how many more people I add, they just won't be able to get the right information. So we want to keep that down. We're trying as best as we can, and the way that you all can help us keep those numbers down is by continuing to wear your mask, wear your distancing, making sure you're washing your hands. Don't forget these very basic things, and of course the 3 C's that we've been talking about all the time: the crowded spaces, closed-in areas, and places where you can't distance of 6 feet in crowds. The other important part of this is we're also seeing the weekly count of emergency department and freestanding emergency rooms go up for COVID-like illnesses. And our admissions in the hospitals are going up a little bit. However, we remain confident that the hospitals are still in good shape because they still have at least a 25% capacity that they need, both in the general beds as well as in the ICU. And ventilators have never been a problem in Palm Beach County, so we're not worried about hospital surge. We want to continue to keep these numbers down, though, for the purpose of our family members and the, not spreading the virus any further. A lot of talk about the vaccines that are coming up. We're very excited that we now have some actual factual vaccines that seem to be very effective. We're very happy about that, and we are looking forward to when they are able to be approved by the FDA for emergency use, and when they will begin producing the vaccine to then give it out. We know that the priority is going to be first elderly in nursing homes, ALFs, and other long-term facilities, the healthcare workers, especially in hospitals, and then first responders and other healthcare workers. So we are ready, we're planning, and we're continuing to get information from the state, from the feds, in terms of how that's going to be rolled out and how that is going to be handled. The first thing that has to happen for the vaccine to be given out is that they have to start producing it. And so we're not just producing vaccine for the United States, we're producing vaccine for the whole world. So it will depend on the feds of how they roll that out, how they do that state by state, and how it comes then down to us. So we're looking forward for more information as that progresses and as that goes along, and we're ready for it. And it will probably take until at least April or a little further until it finally comes to just the general population. And then remember that in order to have herd immunity, which is when at least 80% or 70% of the population either has a vaccine or has gotten the virus on their own, that's when you start relaxing and we can start going into a more normal period like we do with H1N1 in 2009 when we finally created the vaccine and we had enough people vaccinated. As a matter of fact, the vaccine that we have now for the flu has still the H1N1 because it's still circulating in the world. So these things don't go away. We just learn how to be able to handle them. So it's very promising. It's a new revolutionary way of doing vaccines. And from a scientific perspective, it's really very exciting to see a new method for creating these vaccines.
Thank you, Dr. Alonso. Before we turn to Commissioner Weiss and Ms. Julie DiTallo and our county administrator, I wanted to give a brief update on where the county is at in terms of our ongoing response to the COVID-19 pandemic. I stated earlier we're at day 249 of our response to COVID-19. Obviously, and this has been ongoing for some time, there's definitely some COVID-19 fatigue, and you balance that with some of the good news that's on the horizon with regards to the potential of a vaccine and herd immunity. We're now entering a time period that I think where most of us are excited about the holidays. We want to be with our family. It's easy to let our guard down, but we have to remember how much hard work went into getting this county to where we're at. We've consistently been below the statewide average for positivity. We've consistently opened our economy earlier and our school system earlier. And so a lot of the good work that's been done, we should not do anything to jeopardize that as we go into the Thanksgiving weekend. So remain very cautious and diligent. We know that the compliance with the mask order in Palm Beach County is well respected, and that order is still in effect. We'll remind you not to go into closed spaces, crowded spaces, or confined and enclosed areas. Testing in Palm Beach County, testing remains one of the most robust tools to both trace the prevalence of COVID-19 in our community and also isolate individuals that have been infected with it through contact tracing. So in Palm Beach County, we have a very robust system that is still in place to date, and in the last 7 days, Palm Beach County has conducted 15,344 tests in the county in conjunction with our government-supported testing sites. To date, we've had over 175,000 tests done here in our county through 3 mobile assets and our freestanding areas where you can be tested through the DEM or county government. For specific details for rapid testing, we have that option here in this county for our residents. You can go to www.pbcgov.com. Again, www.pbcgov.com. You'll also find a wealth of resources and information that would be important to you. If you haven't visited that website yet, we highly recommend it. A reminder that the Center for Disease Control and Prevention has issued a warning about holiday travel to be cautious, and they do not encourage it. COVID education and compliance team, it still remains in effect. Of course, the focus and mission has changed a little bit since we've entered phase 3 in Palm Beach County. The COVID education and compliance team is still going out on a very often basis. They are assisting primarily with educating businesses and providing the needed PPE supplies. However, there are some enforcement opportunities for community or businesses that are not enforcing the mask mandate within their establishment. So we remind business owners to please do the right thing and remain vigilant in asking your customers to wear face masks while they're within that business facility. We're going to have An update from Ms. Baker on our CARES Act. You'll recall that $261 million was appropriated to this county specifically, and through the direction and leadership of the Board of County Commissioners as a whole, we've directed the county administrator to disperse that money in various ways, and that's been ongoing since receipt of that $261 million. Ms. Baker will give an update on where that money has been spent and what we will also see in terms of support in the future with regard to the CARES Act money. It's my pleasure now to call to the dais or to the stand Commissioner Greg Weiss.
Thank you, Mayor. Good afternoon, everybody. Greg Weiss, County Commissioner, District 2. And I just, on behalf of the Board of County Commissioners, want to wish everybody a happy Thanksgiving upcoming next week, but to remind everybody the importance of staying safe. And that means, unfortunately, not gathering with folks from households outside of your own, and still staying socially distanced. It's always better to be outside than be in a crowded space, and if you're going to bring people together, it's much, much safer to stay outside and stay away from each other. This is going to be a Thanksgiving holiday season like we've not had before, but we're asking everybody to do the right thing, make these difficult decisions, and practice the guidance and guidelines of the CDC and our health professionals. We will get through this. As you've heard, we've got a vaccine on the horizon. However, it's not here yet. We need to continue to practice our social distancing guidelines, washing our hands, and wearing our face masks. We will get through this, and we're going to try and keep as many people from getting sick, and of course that then would lead to less hospitalizations and of course less deaths. So as you're making your plans, please do the right thing. The other thing to point out, understanding how these tests work. The tests that you take are good the day you took that test. So if somebody takes a test, the next day they could come in contact with somebody and pick up the virus and not be aware of it. So just remember, a test is only good for the day you take it. On behalf of the Board of County Commissioners, I want to wish you all a very happy but a very safe Thanksgiving this year. Thank you, Mayor.
Thank you, Commissioner Weiss. Again, I'm also joined by Commissioner Mac Bernard from District 7. We also had 2 new county commissioners join the Board of County Commissioners. We have County Commissioner Maria Marino in District 1 and County Commissioner Maria Sachs in District 5. It's my pleasure now to invite to the microphone Ms. Julie DiTallo, the interim CEO for CareerSource, for an update on how to access reemployment resources. Ma'am?
Thank you, Mayor. We're happy to report some good news today in Palm Beach County with the latest numbers. Palm Beach County's unemployment rate for October fell to 6.1%. That's lower than last month's 7.0%. That marks our 3rd consecutive month of improvement in the county's employment picture. The county's rate also fell below state and national levels, and veteran unemployment dropped, and thanks to the mayor and the VFWs and nonprofits working together for our veterans. Here's the really good news. 118,000 more people are working this month than last month. And those jobs that we lost in March and April of this past year have been recovered. 53% of our jobs have been recovered. The labor force in our county has increased, showing that we are re-engaging in the workforce and people are looking for jobs and getting them. So if you don't have a job and you're looking for them, come to CareerSource, go on our website, careersourcepbc.com, or visit your local library where our employment teams are located. Our Delray Library has career counselors that speak Creole and Spanish as well. So there are opportunities for you to look for jobs and get some job skills as well. We're doing better than our major municipalities in the state, such as Broward, Miami-Dade, and Orlando. And we're actually doing better than most of the country. And that is related to the diversity of the industries in Palm Beach County. Related to that, businesses are moving to Palm Beach County. People are coming down here for season, and we're going into season. These are all good indicators. Also, the BDB has brought in 25 projects into Palm Beach County, accounting for 3,000 jobs. So we're encouraged by the steady improvement in our employment picture and with our job gains in all of our major industries. Thank you. And now I'd like to introduce our County Administrator, Virdina Baker.
Thank you, Julia. Mayors, commissioners. That is excellent news that Julie just shared with us. And part of the reason is because we were so low in our positivity rates in the past. We must continue to work together as a community to lower our positivity rate, because businesses look for communities that are self-sufficient, that they're relying on their own worth within their counties, and that is why we're at the top of the list. So we need to continue to wear our face masks, to distance, to ensure that we avoid the 3 C's, and we continue to work with our businesses here in Palm Beach County. As the mayor stated earlier, we received $261 million from the state in CARES dollars. We've allocated those dollars. Palm Beach County, the Board of County Commissioners allowed staff to allocate these dollars to various programs. One of those programs was our mortgage assistance program. To date, has distributed a total of $9.5 million to almost 2,000 households in Palm Beach County. This program provides relief to homeowners who are in income eligible households. The portal is no longer accepting applications. However, the applications that are within the portal that met the deadline will continue to be reviewed for eligibility and processed for payments. CARES funding assists with mortgage and escrow payments, late fees, attorney fees, condominium, homeowners association fees, special assessments, and other mortgage associated costs related to COVID-19. The Palm Beach County CARES Restart Business Grant program has distributed a total of $72.4 million, and that's to roughly 4,600 businesses located here in Palm Beach County. Although that portal application is also now closed, we still have applications in the process. They are being reviewed, so if those applications met the deadline, we will continue to process those applications. This funding was made available for businesses affected by COVID-19 and can be utilized by those businesses for expenses needed to keep the business operational, including commercial lease, mortgage payments, inventory, salaries, and PPE. An additional $16 million was allocated to process rent, utility, and food assistance. We're all very conscious of the fact that our eviction process has expired. We are gearing up here in Palm Beach County and has been trying to address this through the court system, those that we can identify, and actually pay rent so people are not evicted from their homes. Our goal is to keep our homeless population down to a minimum, and these CARES dollars have definitely helped us. We are hoping that our congressional people will allocate next year the HEROES funds, which will assist us in continuing to keep people in their homes and with their lights on. We also provided food assistance. We have funding remaining for food assistance. If you are in need of assistance in this area, please call 561-355-4792 or go to our website, www.pbcgov.org, and look for the food assistance link and go to the utilize that link to apply for food assistance. So again, we want you to stay safe. We want to work together as a community to ensure that we can keep our businesses open. We can recruit more businesses to Palm Beach County. We can put more of our residents to work. And please utilize CareerSource as an avenue to obtain job assistance as well as training. Mayor, thank you.
Thank you, County Administrator Baker. In closing, just a few points to make clear that you're all aware that the governor, through the Commissioner of Education, has extended the ability to attend school virtually throughout the state through the next semester. Also, we're well aware that the mask has emerged as the most potent and effective weapon in our response to COVID-19. As a result, the board has authorized and the county administrator is executing upon a second round of direct mail for masks just like this that are reusable and washable. Will begin to go out to every household again in this county, about 660,000 households. We are the only county that I'm aware of that has done this, not just once, but twice. And I think if you look out in the community and see how many of these combat COVID masks are still worn today, just how successful this program has been. And so with some of the remaining funds through the CARES Act, we will be doing one more mailing in the near future. And then finally, on behalf of the Board of County Commissioners and county government and our operational response partners like CareerSource, like the Department of Health, like the Healthcare District and DEM, Emergency Management, we remain committed to communicating with you accurately and often. We think that the ability for a government to communicate directly with its residents is one of the most important aspects to responding effectively to COVID-19. That's one thing that I hear most often, is that the ability to communicate and inform our community is very much appreciated by the people of this county, and the feedback and communication that we get back in return is meaningful to us. And so again, we remain on behalf of the Board of County Commissioners committed to accurately and often communicating with our residents, not just on COVID-19, but on any issue that will impact our residents' lives. With that, I'm happy to take any questions, or we can ask any of our speakers for a question. Steve?
Mr. Mayor, we're hearing from a teacher at a school district elementary school here that administration told the teachers to make sure that all the learning material went home with students today because the administrators were not sure what was going to happen. Are there any plans in the works for the district to go back to all virtual learning?
The question is there any chance that the district can go back to all virtual learning here in the county? And the catalyst was that were some comments that a teacher made about uncertainty for the future. I don't want to speak, and I will not speak on behalf of Chairman Frank Barbieri and the superintendent, Dr. Fenoy, and the school district as a whole. What I will tell you is that I did speak with Chairman Frank Barbieri yesterday, and the issue of virtual learning, and actually the specific issue of coming back or not coming back after Thanksgiving was discussed. And from my conversations with him, again, not binding, I'm not an authority on it, but that wasn't an option.
And then my other question, Mr. Mayor, is at this time, are there any plans in the works or any discussion amongst the commissioners about imposing further restrictions given this new spike?
Well, the question relates to government and local restrictions here in this county that we had in place in prior phases of our COVID-19 response. I can tell you that as we entered phase 3 a while ago, a lot of the local authority was curtailed. We still do have a mandatory mask mandate in the county. Whether it's enforced or not is a function of the state law and the orders of the governor. What we do know is that government regulation through COVID-19 protocols is a difficult thing for the economy, but we also know that at the height of the pandemic, and it seems as if we're inching closer to that metric again, that they were effective. So the board will consider, and it will come directly from the board, it won't come from me, I don't have that authority, but the board will continue to consider our options in imposing regulations to control COVID-19. I know that I speak on behalf of the board when I say that is not our hope, that is not our goal. I think that if you need at this point a government intervention to know how to conduct yourself safely in this environment, then that's unfortunate. We should all be doing this as an American patriot and as a resident of our local community, and that's what we've seen transpire. I'll be candid with you, in the initial phases of COVID-19, we didn't know what to expect, the community didn't know what to expect, the nation didn't know what to expect. But now that we've been through this and we've seen what works and what doesn't work, what I take from that is that we all have a unified vision and commitment and obligation to wear our mask, be cognizant of where we're at, don't gather in crowded spaces. And what we also know is that if we do that effectively, we can have a robust and recovering economy, and we can protect the public health and the capacity of our hospitals.
I've got two for Dr. Alonso, if possible.
Even better.
Hello.
Hi, Doctor. If mask wearing has been somewhat effective, as the mayor said, right, there hasn't been a problem with people not wearing masks, are you able to show metrics as to where this spread is coming from, this new uptick in cases, what's driving it, or is that too unknown?
the question is, can I sort of pinpoint or gather information to show where the spread is coming from? Absolutely.
Even anecdotally, yeah.
Absolutely. We have a chart on the COVID county report that shows the aid distribution of the new cases. That's a very useful report. That, together with the information that we gather with our contact tracing, we know for a fact that the 15 to 44-year-old represents more than 50% of our new cases. And if you add the 45 to 54, you have another 20%. So a very large portion is in that group. What are those people doing? They're going out, they're not wearing their masks, they're going out either to, you see them on the boats, you see them at the restaurants, at the parties at night, large gatherings with many people and a lot of drinking. So that is what we want to emphasize. So everybody listening to this, please, we need to cut back on that so that we can have that 15 to 44 go down as far as the new cases. There are a small percent, over 85, only 1%, and a few of the elderly going into the hospitals. But again, many of them are actually coming out and not dying because we have learned how to deal with these patients a little bit better. So that's the reason that our hospitals are doing well despite the numbers being much higher than they were in the beginning. We have been practicing medicine, and that's what we mean when we practice. We get better at it. So that is a very good thing, and the medical community has all joined together. What is happening in other states is that those peaks are so large that they can't maintain and the hospital surge is occurring. So we do not want to get there. That is why we're so insistent. Please, 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 the public, wear your mask, do the distancing. We do not want to look like the other states.
And do I take your remarks earlier to mean that the county has secured the necessary funding to continue contact tracing for the foreseeable future?
Well, whether the state was going to give it to us or not, I had made sure, and we went ahead and started hiring more people. The county was very generous in giving us some funding to get us through December. The CDC has committed to continue doing funding for Florida, and we know that we need, without contact tracing, we can't keep a top on this. So we will continue to do contact tracing, and right now the tests are still taking 3 to 4 days. I think with the large number of people going for airlines and requiring the tests, that the lines are a little bit larger than they should be at the testing sites, but we're still getting back those tests between 3 to 4 days. So we're still doing a good job on that.
And lastly, I know that when positivity rate goes up in a community, a lot of eyes are turning to nursing homes and facilities like that to make sure that they are somewhat protected. I know at the beginning of the pandemic, the county was doing spot checks on nursing homes, things of that nature. Is that still going on?
That is absolutely still going on. We're still checking on all our long-term facilities. We give them any help that they need. They are testing. They're testing their staff. They're testing their patients that they have, and ACA is also staying on top of them, making sure they're doing the right thing. Thank you.
All right, well, barring any further questions from members of the press, thank you for covering our update today. Thank you to the members and residents of Palm Beach County for being so diligent and so proactive in protecting our neighbors and our families and our friends. I hope you have a wonderful Thanksgiving. Despite the difficulties of this year, I think we can all agree that our county is getting through this effectively, and we have much to be thankful for. And so we'll focus on that. We'll do it in a way that respects the public health. Thank you, and have a wonderful weekend and a wonderful Thanksgiving.